Hello, friends. Welcome to the Ancient Health Podcast. I'm your host, Dr. Chris Motley, and today I have my close friend, Dr. Jamie Ho, with me today, who's a doctor of optometry. And I don't know all of her credentials because there's so many, and I'm just saying in a positive way. But Dr. Ho works with vision, not just vision. And from when you're going to hear today, she works with individuals that have different infections that cause problems with the eyes, inflammatory processes, and even alignment and cranial physiology. So like literally if your skull is not aligned properly, it can affect your eyes. Thanks so much for joining us today.
Thanks for having me, Chris.
We've known about each other for a while. So Dr. Jamie is in the Nashville area. I'm in Franklin. And the first time that Dr. Ho and I encountered, like knowing about each other, I remember I had a patient, and I won't name his name, but he'd fell off a piece of playground equipment, and he had concussion issues. And he had vision issues, and my patient's mother took him to Dr. Ho. And when I examined him, I found that he'd had maybe some processes of Lyme disease, some infections, and he could not stay focused with his eyes in the sense like his joints would always be, in a sense, misaligned, and his inflammatory processes around his head was always very, very congested. So if you guys have brain fog, if you have problems remembering things or short-term memory, started to see Dr. Ho, and his signals, what I call them my acupuncture signals around his body, started to calm down and balance. And his vision got better, his headaches went away, his migraines, and even his ability to really read well and to follow script. And I was like, what did she do? And they were saying, oh, she did these different neurological exercises. And she works with individuals that have Lyme disease and knows about it. And I was very impressed and very grateful. So I just want you guys to know that if you guys know anybody out there that has these types of conditions that have visual acuity or any type of visual problems, this is the podcast to listen to. So first of all, I said all that to say, I want to hear about your background, about your story. I want to hear about you. Can you tell us a bit about you, what got you into this type of work and this type of passion?
I think a lot of this is from dealing with my own journey of my own healing. But part of when I was an optometry student, I was actually involved in research already. I was involved in clinical research. I was studying amblyopia, which is lazy eye. So especially anisometropic amblyopia, which means there's a difference of processing between the two sides.
Oh, yeah.
And that later became my passion because how the eyes don't process evenly together, like binocular vision, so like two-eyed processing, that's affected in areas of inflammation, that gets affected by injury, that can also sometimes get affected by ocular disease when it doesn't happen symmetrically. Wow. So this was kind of serendipitous, if I will. Yeah. And I went through optometry school, and later on I got hired. This was mostly pediatric research. And later on, I graduated from residency, and then my boss hired me. He was a retina specialist. So I went from lots of pediatric and functional to seeing older patients with eye disease. So I got thrown in the opposite side of the scale, which was very different, but I'm so grateful for that experience because patients with low vision, with eye disease where they have missing spots in their vision, they have to adapt their brain software different to operate and function in this world. So that kind of gave me some insight. And I was always trying to meld together two worlds. So eventually I found myself drawn to brain injury. And personally, because I had many injuries myself all the way from my childhood. And I've spent most of my life adapting around them. I was great at adapting, apparently. I probably have been seeing double for most of my life, but I could still read. I went all the way to professional school. And then I had a very hard time passing my second year because I wasn't the two-eyed individual that I thought I was. So the irony of that is that's how I ended up in vision therapy at my school's clinic. I went to ICO, which is in Chicago. Yeah. Great school. But I really struggled, and I never put two and two together and be like, well, why did I get this problem? Yeah. And it wasn't until, I'd say within the last 10 years, when I professionally was seeing lots of patients with concussion, with strokes, and neurological conditions that I looked at some of these patients and said, wow, I think I have a certain degree of all these problems, just not to that extent.
Yes.
But I've been adapting and coping around them all my life. So I look back and think, wow, what if someone came in and told me this earlier and worked on this problem earlier? How free I would have felt and how less frustrated I probably would have felt. But I was stubborn and I was determined to make things happen. So I think a lot of this is spurred from my own passion of self-healing and helping others on the way heal themselves.
I think that is the best when a practitioner has gone through the journey themselves. Yeah. And I always find that the practitioner has more passion for a condition or a line of work, a field of work, when they've gone through it. So when you went from like working with young people and you went to older folks, and I call them folks because I'm in the South, sorry. I want to go through some of the questions we have here too, but I want to make sure though too, when you said their brain processes differently.
Yes.
Could we just touch a bit? I want to say like when you say a young brain and an old brain, because many individuals out there are like, oh, I've gotten older and my brain's a little bit off. Is it because like the neurons, I hate to say die off, or like what are some of the big things you saw like as they get older from the eyesight of a young person to an old person?
So let's talk about kind of some anatomy first.
Yeah.
And light. So light enters the eye. So how do I know you're in front of me? Well, light's bouncing off you and it's entering my eye. And we hear the analogy a lot that the eyes are like a camera. So there's optics focusing the light bouncing off you into the back, the retina. And then the retina is actually part of the brain already. It's an actual outpouching of the brain.
So it's an actual like piece of brain material, basically.
Yes. So if you look at embryology and how the eyeball develops, the brain outpouches kind of like a flower, and then it opens up. That opening is actually the optic nerve. So and then it wraps around and becomes an eyeball.
So what you're saying is like if you look at the eye, you're like looking at mini brains.
You're looking at the brain, and it is the one place in the body you can see blood vessels and the brain uninterrupted. It's not like you have to dissect into it. You can just look at it through its true form.
That is, okay, really profound to me, because does that mean that sometimes like when people would say that they would look at somebody's eye, and some people have bloodshot eyes or people have like different distortions in their eyes, that could be a clear indication that there could be neurological issues because you can see it in their present eye?
Yes, so you can not only diabetes, hypertension, but you can also see multiple sclerosis. There have been cases where patients were having a brain tumor and it was discovered through an eye exam.
That is amazing. Okay, this is perfectly right. We're going to go all out on this because we have extra time today.
Yes.
So what would be like, would they say atherosclerosis, or if you had diabetes? Are there just a couple things you could tell people, like if you see this in your eye, not to cause fear, but are there a couple of common signs and symptoms that you've seen in eyes that would give them an indication of a bigger problem?
Well, here's the scary part, okay? So in the center of the eye, there's a part called the macula, and most people have heard of macular degeneration. And if the macula is affected, then most of the time, patients will notice, things look a little blurry.
Yeah.
Okay. But most of everything else that can happen around in the eyeball is silent. So that's why it is so important to have an eye exam, an eye health exam, because sometimes we're walking around with lots of silent things. And if we can early detection, that is the key for good health, especially for things that do require surgical and more extensive medical intervention.
Yes. I mean, okay, so we're talking about how the light enters your eye, and I love that story. So it hits and reflects off your retina, or?
So actually the cells in the retina, they start to take on the light signal, and the light signal transfers from the retina back to the optic nerve, remember the opening, and back in through the brain. So your brain, you can think of it like a computer chip. It's actually transmitting light signals. And all those light signals, that's how I know you're you. The plant behind you is a plant, the couch, but it is all just small variations of light.
Wow. And so the variations of light, when they hit and they get, not say described, or like the pieces get worked out in your brain how to see you.
Yes.
So if the eyes, like over time, have like some kind of injury to that area where the receptors hit, that's where you get your distortions.
Yes, but you can also have inflammation of the brain that results in changes of how that light is being processed.
Oh, wow.
So on top of that, it gets complicated because it goes into the brain, but it doesn't even just go to one part of the brain. It goes to multiple parts of the brain. So we have different parts of the brain that control for light cycle. So for example, your sleep, your circadian rhythm, but you also have processes that control what is that object, what we think of sight, but motion processing, color processing are all different parts of the brain. So what most people don't realize is they can have 20/20 visual acuity, best corrected, but they can have motion processing issues. They can have a lot of vision issues that are still present even though they see well.
So if they have 20/20 and they have like a motion, is that why, and I'm not trying to go down a different rabbit hole, like let's say somebody has really great vision, but they have something like dyslexia, or they have, or like the way they program, like how they see things, or like motion, and they can get dizzy if they're in a room that moves, you know, if they're moving too quickly or something.
So I think that was like your patient who came in. I mean, they see well, and sometimes it's frustrating because patients see another eye doctor or an ophthalmologist, another optometrist who doesn't look for these type of functional problems. So they look and they're like, well, you're 20/20, that's great. Your eye is healthy, which I would say like 90% of my patients who have a brain injury or have a concussion, they're 20/20, their eyes are healthy, but that doesn't mean it's not a visual problem.
So that's the difference. Like you're right. It's like, so
that's the program part of the vision. So there's the physical anatomy that we talked about, how light enters the system, enters the camera, and lands in the back and then goes into the brain. And then there's the programming aspect. And that's how our brain interprets light and interprets what to do with that information. So for example, I have some patients, they have what we call visual agnosia. So they can see, but they actually have almost lost consciousness of what that object is. So I had a patient who was 20/20. They had to come into my exam room, touch the acuity chart, walk back into the chair, and sit down. Then they can actually start reading the letters. But if they did not touch that ahead of time and they just walked to the back of my exam room, they would just be staring blankly at the chart for 10 minutes, 15 minutes. We could be here all day. So using vision and touch. So that's how we start to talk about vision and integration with your hands, integration with your body. Vision drives posture, all different parts of the brain. So you can have an injury to a very specific part of the brain and lose parts of visual processing.
That is, okay, I like to talk this out with everybody. So like you just said, I could see that camera over there really well. But if the processing center in my brain had some form of injury or some kind of deficiency in it, inflammation, so then it doesn't matter how well your vision is, you still can't process the information coming in through the eye because that processing center's off.
Well, it's confusing.
It's confusing to it.
Yeah, because you don't know, it's like we have some other issues. Sometimes my patients, they call it a visual spatial issue. So they walk into the room and to you, the room looks like the floor is flat. But to them, the floor is an angle.
Oh, yeah.
So I had someone who was actually very apt in construction, a patient in construction. And he said, I sat at that hospital bed. And he said there was a cabinet, and he's really used to measuring it. And he said, it was kind of funny because it looked like one side of the cabinet was fatter and the other side was thinner. And he said, I knew that was physically not possible, but that's the way it looked like to him. And so you can imagine seeing the world as if you're in a funhouse all the time. And that is very discerning. And sometimes there's a lot of the emotional component of it where patients are being told, especially as they get older. They're like, oh, you're just getting older. You're just, but there's an actual problem causing that. And yes, if I saw the world as a funhouse, I probably wouldn't feel very comfortable either.
Not at all. I think that when you said it is emotional, where they'd say like it's just you getting old.
Yeah.
And I know we practice like it's not you just getting old. There are some aspects. So if a person can't visual process, and we know that it's like your hardware, because your eyes are basically like a really good indication if your hardware.
It's the hardware and the software.
Yeah, that's right. Okay.
So if you don't have an injury and you don't have eye disease, then we're less worried about the hardware, but then the software. And that's kind of where we kind of get into like, how do we influence that entire process? And that's where we talk about the vision rehabilitation.
That's right. Okay, so let's I love it when you said touch the actual visual chart, and they could process it after they added in the other senses, like the tactile, touching,
Yes,
hearing. One thing I want to ask though, before we jump into that, so I'm going to keep that as a mental note. What are things though in this day and age, like let's say the software, like your eyes, right? The actual health of your eye. You're talking about the retina.
Yeah.
What could like really deteriorate the health of your retina over age? Like, is there things that in our environment that would like cause the eye to like get worn out quicker or anything like that?
well, some of it is nutrition. Yes. So if we're not feeding ourselves properly, definitely your retina is actually very metabolically active.
Really?
It takes up so much energy, and vision as a whole takes up anywhere conservatively like 50 to 80% of the entire surface of the brain is actually
Whoa.
dedicated to vision processing.
Really?
And retina is very, very metabolic active. You can think of all that signal going in and being processed. That's the beginning point. So it is incredible. And that's why some of the injured patients, they're exhausted.
Yes.
Because you know what? If vision is going to take up, 30%, let's say conservatively 30%, and I'm running on 100 gallons of gas and I'm injured and I went down to 70 gallons of gas, maybe my brain decides I don't want to put half of my energy into vision. So it starts compromising the program. And that's when we get some strange realities, as I tell my patient.
You get strange realities because that compromise, because it's like adaptation.
Yeah.
It's like if nutrition's not there or some other thing causing
brain's like, I can't handle all this information because vision processing is so heavy loaded. It's so energy consuming that the brain's like, okay, forget it. I'm not going to take in that much. I'll just take in less. So we can measure it through visual fields. We can actually measure how small. We can also see how heart rate variability changes as we introduce different types of visual stimuli.
Yes.
So, vision is a reflection of the body and the brain and the nervous system.
Yes.
And so when vision doesn't operate properly, half of my job is figure out, okay, why do we have this problem? Is it truly in the eyes? Are we having double vision? That's a mechanical problem, So if we have the eyes not physically lining up in space, and one's like off to the side, like some of my lazy eye patients, or we have injury, or we have a palsy from diabetes, for example.
Yes.
Yes, then we can end up with the eyes not teaming. And yes, the brain doesn't like seeing double. So the brain's going to learn how to strategize around that as well.
That's okay. So if it's strategizing and you're talking about that much surface area of the brain that is there to process your vision, and something would actually cause like the nutrition or something of that sort could actually cause
inflammation from mold, from Lyme. That's how our worlds intercept, right?
That's right. That's right. So if you did have like, let's say an infection, you're in a moldy house and it was there and it caused the processing within your brain to basically be diverted because you're like, I don't have
energy to do this. Okay, we're just going to sacrifice it in some way, shape, or form.
That is astounding because so that would be like why somebody could come to you or come to me and say, hey, my vision was really good, but the other day I started having these different, lines in my eye or something of that sort.
Yeah.
Wow.
And also, depends how energy consuming the task is. So if you asked about lifestyle, so reading is actually very difficult. Reading, the eyes have to line up, the eyes have to focus, it has to stay concentrated. There's a lot of little tiny eye movements for reading versus looking at something far away.
Yeah.
So reading is hard. and then reading on a digital screen. So that's why some of the patients complain about the scrolling. They get very irritated by the scrolling screen. They might get irritated from the blueness of the screen. And so every layer adds more. So, a patient coming in, two patients coming in with the same injury, I know that's weird in theory, but if one patient's an accountant and all their job is to be on Excel spreadsheets versus a patient who's a farmer, they would have very different complaints because their visual demand is different. But now we're in an age where we have lots of the younger generation, children who are spending much more time on a computer and on a screen, and their eyes aren't doing the normal eye movement of exploring large areas of space. So we're changing their program and how they're growing and how they're adapting.
So if they adapt, like let's say they're hyper-focused on a screen instead of being outside or seeing something huge, you're saying it actually will change the way they process and program even visual information.
So we're seeing a much higher incidence of nearsightedness develop. And we saw this, even the rest of my profession saw this, lots of what we call myopia, nearsighted development, especially after the pandemic, where most people became online schooling, right? So
they actually were like, if something's this close, so they're not training, because you have to have like seeing larger, rounder objects to help.
That's what our vision is built for. Our vision is actually not built for up close, prolonged work on a screen. That's not how, our eyes are adapted to process large amounts of space, just like any animal in the animal kingdom.
And that would in turn help your brain health. Like if you were doing, because it actually helps the child to process good amounts of information to help the health of the brain too.
Well, also help them be physically active. So if I'm used to always being here, going anywhere out here is scary. Why would I want to be out here? So in turn, sometimes I tell parents who are fighting this idea, I said, well, what's going to happen when this kid gets to be 15, 16 and needs a driver's license and needs to go? Because we're not even talking about, go be a star athlete on a team. I'm not even, we're not talking about organized sport. I'm like, just some form of physical activity, because we are training the experience. So our hardware is actually intact around 6 months of age. We're not born with everything intact already.
Yeah, but after 6 months.
About 6 months. And, most point, the babies are sleeping. But after that, the software, so the day-to-day life experience is what trains the software.
So I'm really intrigued by this. I love hearing about this. So if, like, let's say a child right now, like people are asking that, they give them screen time, and I know that patients will come in and they'll say, hey, I only give them screen time. And I get it. If you're on a trip and you want to have some little bit of peace, like you're going to give your child.
But that is going to be the world most people will grow up in.
That's exactly.
So we can't avoid screens.
You can't avoid it though. But what would you notice? You're saying when a child does, their visual acuity is getting a little off. They're getting myopia. They're getting the nearsightedness. Would that, you're saying it could actually hinder them, like you say, like from like driving very well, or like doing like a sport or an activity where their coordination is required to do something.
Because your body needs to move through space. So the big interest that I've started developing is over time, and especially this year, is how does vision and the body and body movement in particular intersect?
Wow.
Because vision, like I said, if the world looks crooked, my body's going to adjust crooked.
Yes.
Now, if we're young, maybe we can manage. If we're older and all our muscles maladapt in a weird angle, then we're going to hinder patients long-term and their mobility. And if we hinder their mobility, we hinder their health. Right.
So it's also intertwined, where you're saying that the coordination of their body, the joints, everything is very dependent about how a child or an adult processes large amounts of information. Now we're in a world where like here, and it actually can affect our physical body.
Yeah, so there's feedback up and down. So our eyes tell our body how to move, but there's a lot of feedback. I spent over a week with lots of body workers this year, massage therapists, physical therapists, athletic trainers, taking their courses. And realizing, wow, there's a lot of feedback from the body back into the visual system, and realizing that sometimes some of my prescriptions, we're not prescribing for optimal clarity. We know, you could be 20/20, but if your body is fighting, remember the prescription is really a reflection of the nervous system. So if my nervous system's like this and tight, the prescription's going to reflect it. But do I want to prescribe that for my patient? I'm essentially playing into their adaptation. I'm not really helping them get out of it.
Wow.
And over time, you keep getting tighter and tighter, there's going to be a breaking point.
Yes. So if they're already, their body, let's say it's rigidity or something.
Rigidity.
And you say feeding into it, like they could have the prescription that actually just sort of accentuates it and keeps it going.
Because if I'm looking at it, I'm like, well, I'm just prescribing what I see. So that becomes the art of prescribing, where I will tell the patient purposely, I'm like, look, this will not be the clearest pair of glasses, but we're trying to move the system to reduce long-term problems and long-term deficits.
And
sometimes
great.
they come in with those problems already, and they're like, well, but I see well. And I said, yeah, you see 20/20. But that's not, but obviously you're coming to me for a problem, and that problem is not being addressed. So, a lot of it is, I call every brain has to negotiate through a pair of lenses.
Yes.
And remember, we said the brain interprets how light is bent. So we can subject the brain to light. That's light therapy. We can subject the brain to lenses. All lenses will bend light in some shape or form.
So if it bends it, and you're saying that the eyes are 20/20, things are coming in out fine, but the processing center, the hardware is like got those different, adaptations. Software has different adaptations. Now you're saying that if we could somehow change the prescription to break them out of that adaptation, it would actually be a lot better for their body.
Yes. So actually, one of my close referrals is mostly from body workers. Every body worker that I went to a course with, they all knew that what they do affects vision. It was fascinating.
Oh.
And one of my good referrals is a athletic trainer, and he purposely sends me patients. They're almost all 20/20. And he tells me, well, I have something locked up. The left hip is locked up, or the right shoulder is locked up. Can you do something, prescribe something that can help me unlock certain things? So there is an art of prescription, and there's different ways of bending light. We can do it in a prescription. We can do it with prism. We can do it with colored lenses, tinted lenses, to change how the brain processes light and change how it influences the body. And so I send these patients back out with the prescription, and this trainer will reinforce the motor pattern. And we always tell the patient, this is like a training pair. It's like training wheels in glasses form. We're going to train you, and eventually you're not going to need the training wheels, and they come out of the prescription. But like I said, they're all coming in, and they're 20/20 already.
So they can change their way of being able to perceive and do things,
and change their body posture, their body alignment, and how they hold tension.
That is amazing, though. So what would... Okay, I don't want to shoot too far ahead, so bring me back in. But whenever you, like the trainer sees like, okay, my left shoulder is off. Yeah. So let's say a person out there says, oh, I have a really tired left shoulder. And you can assess. I want to go over somehow the way you assess, because you assess me so well. And you can assess how they, like neurologically, how their eyes are actually, you showed me like how I can perceive information over here or over here, and my eyes are not really here. My eyes are really, like they're different angles and such.
So there's the central vision, and that's kind of the diagram there. The central vision's the arrows, right? And the arrows, that's like the macula. That's like, what is it? That's what most people think of vision. What's that little letter on the QED chart? But the other part is the peripheral vision. The peripheral vision is really interesting, because the peripheral vision is not only from the eyeball, the central vision. The peripheral vision is from information. It gets influenced by information from the ears, the neck, the body.
Yes.
Because it is for localization. Like, where am I in space? Where is that object? Motion processing. Yeah. And so the peripheral can get influenced by outside means, outside of the visual system. And so that's why we have to spend time looking at, if the patient comes in with a hearing problem, or they have Meniere's, or they had a physical injury that just hit one side of the body really hard. Those are all things. I'm not a body worker, but through taking their courses, I've gotten better at kind of cueing in. I'm looking at particular eye movement patterns and how things should integrate. So if something is not following a logical pattern in my world, something else outside of it is influencing it.
That's amazing.
And so especially shoulder neck problems are probably my number one. I've seen a lot of that because the circulation is getting pumped from our heart coming up our head. So if we have compromises in our neck, even if we get very tight necks, a lot of us have been in car accidents. I've been in a car accident, whiplash. That can affect how the eyes and the brain work because we're compromising circulation to such an intricate system.
Wow. So that to me is so fascinating because when you talk about, let's say, the shoulder, like the circulation is off, and can it be both ways then? So it could be that somebody had a processing problem, like let's say they had Lyme disease or they had a parasite, and they can't perceive something correctly, that they could shift their body in an attempt because they don't have enough processing power, and like say the joint gets taken out, or is it like vice versa too?
So two-way. So yeah, the body courses I took, they said, okay, for example, if my body's really tight here, but I need to move forward in space, right? And if I'm tight and I can't push my body, we could use the jaw and bite down and pull this, so now we have a lot of dental stuff that's pulling to vision because the top of the jaw is the bottom of the orbit. So this can pull some nerves around. We can look at my skull model. Everything's very intricate. Or we can use vision and draw the body towards this side.
So you can use both things.
Yes.
I'm sorry, I was away from that. So we can use both of those things.
Yes.
So
there's lots of compensations. It's the body is so well built, and the brain is just an amazing piece of hardware, software. So you can see here, the brain is like a piece of butter. That's the texture of it. I know, this is my little model here.
I love this.
But you can see in here, the skull, I don't know, has very small holes and openings. And the brain's sitting here. And like I said, the eyeball is part of the brain. So you can imagine that part of the brain in charge of vision has to go through one of these little holes. And that's not the only thing that goes through the hole. There's about lots of different nerves go through the hole. So your auditory, your facial nerves, all go through these little holes in the skull. And the skull's not that solid. It's actually made out of multiple pieces of bone that are still live and moving. So very fascinating. So you can imagine, let's not even talk about trauma where we have physical injury to the eye.
Yes.
Talk about inflammation. Because the brain is being bathed in fluids. And it's not just the brain. Remember, it's the brain and the spine. So you can see where the whiplash stuff comes in.
Yes.
Or if these two bones in the top here don't quite sit where they're supposed to. Or we're just spending lots of time on our cell
phones like this?
Yes, I have definitely seen lots of engineers who are on their computer 15 hours a day. So we can also induce those problems. But yes, you can imagine that will actually impede circulation and flow around the brain and subsequently around vision.
Yes.
So, and then you can imagine if someone's had trauma. I mean, we've had patients that had their skull completely fractured, and some parts of their skull are being held together by literally screws and metal mesh. So that puts quite a wrench into the visual processing system. So,
that is like amazing because if you have, like, let's say they did get hit on the side of the head, and like one of those bones is made of pieces. The bones, let's say, gets like cracked, or I'm serious, gets misaligned. Then you're saying that since the holes in the skull, you have different nerves going through those holes.
You have at least 5-6 nerves going through each, like little holes. So and that's why you have concurrent different types of neuro that get affected, and sometimes there's multiple problems that present together.
Yes.
So part of that is also understanding anatomy and understanding where everything comes from. Yes.
Yes, and so if somebody out there. This is like great because you're talking about like an engineer that's on a phone, or you talk about somebody who got hit in the head when they were in high school playing football,
or get hit in the face by a basketball. I've heard that story many times. Right?
Literally. And so if they did put some torque in the skull, or clamping down on those little holes in the skull, as in like inflammation,
or causing some slight misalignment even, or nasal, so deviated septums, like allergies, really bad maxillary sinus allergies.
Around here.
So they're putting pressure backwards into those nerves. So yes, sometimes we get a lot of complaints about my eye feels funny, my eye's irritated, and it actually has nothing to do with the eye. It's like from different sinuses kind of flaring up.
This is amazing. So like, let's like whenever, if we take this and like show like on that, okay. Now, if you had, let's say the maxillary sinuses, or if you got a congestion in the head, that, like, along with any other inflammatory process, like to say there's parasites or Lyme or something around in the cranium, that in turn could cause your posture to change, you to do this and change.
Your brain's going to compensate. It's going to rewire the software.
That's going to rewire the whole thing.
It's built to solve problems, right?
Right. And so when you're adapting, this is another thing you said that was very interesting. When you talk about your eyes and the health of your eyes and the mouth, like the maxillary, you were telling me that the palate, is that right? You were saying even the palate, you bring dentistry into this because, is that right? The orbits sit on top of that. You were saying that.
So the floor of the orbit is actually the maxilla. Yeah, so this is all connected. So I have definitely seen some dental cases drag the vision along with it because, especially with children, especially people who have very narrow, and the floor, the roof of their mouth is very narrow, so it's kind of pulling on all the nerves, and it's changing how the eyes and how the eyes move and how the eyes move as a team. And it could be tighter on one side versus the other.
Yes.
And then all you need is an injury on top of that, and now we have a perfect storm. So a lot of this is, for me, is studying my patients' patterns over time. Yes, a lot of us have some asymmetry in our faces naturally, and looking at particular patterns of my patients. And if something changes, I usually will ask them, okay, what happened? Especially if they're just going to come in and see me annually.
Yes.
A lot of times, patient fell.
That's right.
Yeah, especially my older patients, but even my younger patients, just like your patient fell in the playground. We don't think about these things.
No.
They might not have a full-out concussion-like symptom, but we never know how many hits it takes for them to get there either. So if I see it in their nervous system, usually I treat it. I'm all like, let's go treat it. Because then I drop that threshold again, and I'm less worried about it causing more issues. But kids are definitely not exempt.
Not exempt from it.
Yeah.
Because that would get me to think that every aspect of your life, let's say you got concussion, which is structural, sinus infection, which is like a biochemical issue, palate issues, which could be allergies,
tonsils, you name it.
That can change the actual orbit, the area around the orbit, swelling the nerves in the brain, and your eyes will compensate, trying to help you accommodate to all of that.
Yes, yes.
So like if somebody comes to you and like they're listening today, sorry guys, they come to you and they're saying something to you like, I have double vision, you would be able to, which is great. She did it with me, which was awesome, to be able to do like, one of the neurological exercises was like I had to touch something like that was far, and I had to like use my other senses to find like the piece like
and on your visual memory. So I'm kind of trying to figure out, your center vision, which we talked about, which is your acuity. I'm less worried about that. Your peripheral, it's being influenced, right? So your side vision. So does your side vision tell your brain the right thing? Is it calibrated properly? Because if you think this is straight and this is straight, we're going to have some issues, right?
Yes.
And it depends on how well you've compensated around that problem.
That's right.
Yeah.
And so when you get a test back like this, because it could be so many different things that could cause a visual acuity, but your expertise would be, well, I see this, like this part of your neurological exam is this way and this way, and then you get their history and go, oh, you had really bad strep or something, sinus, and you go, oh, that infection in that maxillary area or that pressure could possibly be causing you to have a neurological problem doing this exercise with your eye.
Yeah. So we, sometimes I don't know exactly where in the history. And it's interesting because just like you, most of our job is asking good case history questions.
Yes.
And that doesn't end at the beginning of the exam. It's just like when I used to precept students, I'm like, that's not the first 10 minutes of the exam. That is throughout the exam.
Throughout the exam.
And yes, I'll quite share with you, I had this older patient of mine who was referred to me for dry eye. And I said, I'm not a dry eye expert, so I thought this was interesting. And what happened was they had the cranial nerve that affects the dry eye also affects eye teaming. And it turned out, and after the 5th or 6th time I saw this individual, I kept asking, and she was 90-something years old. I kept asking her, are you sure you haven't had an injury? And about 6 sessions after she came in, she said, oh yeah, I was in a really bad accident, and she had wiped it out of her memory.
Just totally
because, sometimes we do that. That's how our body our brain deals with trauma. And a lot of these things, it's fascinating. I'll have seniors who will tell me about some random injury or some incident that happened to them as a child.
Yes.
Like they will recall things. And I'm sure that happens with you too.
Yeah.
As you ask those questions and prompt them and say, this is what I'm seeing. Where do you think that's from?
Definitely.
Right?
And that's where the history,
Yeah.
I think everybody out there listening, there's times I've had patients would tell me, Doc, everything was really good, like a double vision. It was really good when I was a young guy. I had a guy that hit the front of his head right here, and it changed his visual acuity in one eye. And then he started having behavioral issues, like he could not process things. And they said, the parents of him said, yeah, he changed after that. And so whenever somebody comes in and says to me, oh, I used to play a lot of sports, or I am very careful if somebody says, oh, I slipped and hit my head, or the little kid went over there and banged their head. I'm like, that is not a light thing. You have to check that. Yep. And even last night, late night, a patient said, hey, can you see my son? His eye I think the sibling kicked him on the side of the head, right? And the whole side of the head was fixated, and his eye would not stop swelling. And so when you can take that information, and people out there listening like, yes, that happened to me, and then we can do neurological and different type of testing, you can put the pieces together. Because one thing I think is so great that you're doing is that I want to hear the story that you told about some of your patients, how they're realigning, the blood is starting to flow, that you're changing them with your prescriptions and how you're changing them. Because people out there are like, I can't get out of my stiffness. I am not, I'm always got a chronic neck problem. I'm getting old. I'm getting arthritis. I'm like, no, it could be your eyes.
Yes.
Definitely.
Yes. And I told you about myself. Actually, I let a bunch of body workers determine my own prescription, since it's hard for me to evaluate myself. And here I am with my current prescription. I am about 3 lines below my best corrected, which is still legal for driving. It's fine. I can function. But I can process moving objects much quicker. And I had chronic tightness on one side of my body from injuries from my childhood even. So these are long-standing motor adaptations that I've had all my life. And to see them release decades later, actually the first few days I wore the glasses, I actually had pain on the opposite side because the compensation was starting to level out. And I regained flexibility in my hips that I have never known existed, shall we say. So just almost immediately.
So you were like, this is an exaggeration. Yeah. So you're like, your body's like, all of a sudden you put these glasses on, your body goes, oh.
And just within 10, 15 minutes, I can adjust and I know where it's going to go.
And then
at some point, sometimes if I have to build things in the glasses, it may over-adjust, and then I have to kind of readjust the glasses again. So think of it almost like a titration system. So I have patients, for example, they have 2 pairs of glasses. One is, I call it the heavier and the lighter, and it depends on their neurological process. So people who are chronic, like Lyme, like cancer. And so they know if they have to put the stronger ones on, this is not a good day. I need a lot of support. And hopefully, I said, you use it like a barometer.
Yes.
And you need to put more self-care into your schedule that day. And then they might be like, oh, I went back to the lighter pair this day. Oh, I'm feeling great. And that's okay. Because the more of these supports that I build into the eyewear, yes, it compromises acuity. And so a lot of the questions I get is, oh, these glasses aren't as clear as I used to be. And I said, yes, that's true. But we're trying to work through that process. And I always have to remind them because most people, the public notion is glasses make things clear. If things are clear, things are good.
Yes.
But this isn't always the case with these type of problems.
When you talk about the eye in the sense that the visual acuity and you yourself had the problem, for me personally, like whenever you start to see that your body will change and shift, like you said, somebody that had Lyme disease or cancer, it can shift dramatically from that condition. When you put the glasses on, do you feel this way? I'm asking as a practitioner. Yeah. Some individuals are afraid of pain. They're afraid of pain. And I love that you told me about the gentleman in your office where you told him he had the glasses. He says, man, 3 or 4 days I was really sore because he was starting to write back.
So that was, I think that was the story. One of my patients was a professional photographer.
Yeah.
So he spent a life with manual glass lenses. So always tilted on one side. They have a dominant photography hand, I guess. And so he was always tilted. So when I gave him his glasses, yes, that was my word of warning to him. I said, you're probably going to be sore when you get these.
Yeah.
And he said, yep, okay. And he said, I'm glad you told me that because he spent about a week being really, really sore. But then after that, he lined back up and he was like, this is amazing.
That's so crazy. So for people out there listening, I get adamant about it because that was a lifetime of doing that type of work and in a week, because the beauty of it is your eyes are neurological tissue and you're changing your brain when you're doing that. You're literally doing brain work, right?
Yes. So, like wearing the rose-colored glasses, as they say.
Yeah.
But you are changing how your brain processes by changing how light enters the system.
Wow. So it can react that quick.
It can react quickly. I'll tell you another story where actually this is around Christmas.
Stories.
Yeah, around Christmas. So this is a few years ago. I had this sweet lady who came in with double vision, and she had it very long, and she was so sweet. She picked up her glasses probably a week or two before the Christmas break, and she didn't want to call, but she had a terrible adaptation, and she said, I stayed home, and she said all I did was pray. And I said, I'm gonna stop wearing the glasses on Christmas Day. I will put them on because Dr. Ho said so, but I will stop. And she said, I felt like the world was closing in on me. And she's older, and she said, I didn't go anywhere. And on Christmas, she opened her eyes, and she thought she was dreaming because she could see single. Everything get fused. And she never wore the glasses again. She said, in fact, I tried to put them on and I felt crazy nauseated, but all of a sudden I could see, and she never had to touch them again. But she laughed and she came back in and she said, fantastic. Well, that should have a warning sticker on it. Because that's how it made her feel. But she's also been dealing with this problem for a long time. And yes, glasses can make the world feel like it's collapsed.
Yeah.
And sometimes we do, like some children, especially some of my special need populations. When you have the kids who are it's almost like they have ADD and they're just grabbing and reaching and they're just overreacting to their environment, and we need to quiet them down. We can bring in that visual world and calm it.
That is, to me, when you changed her vision, I love these stories because there comes a point where a person, I understand, because some individuals, even in my family, they're going, oh, is it going to make me detox badly? And I understand. I don't want you to be bedridden with toxins. Yeah. But you do have to go through some of the grit to come out on the other side. And I think that's the majority of our healthcare system is, here's something to take so you don't experience any pain or discomfort. Yeah. And that's what I love about this, though. It's not like you have pain. So don't think that, guys. I'm saying that you may have some soreness and tenderness, but
it's a process.
It's a process. Like, you have to go through it. I love stories like, okay, so this is not me saying I have anything with vision, but I will say, like, one patient that I had, this reminded me, I need to talk to Dr. Hall. I wish you lived here. And from what we talked about, I actually gave her some decent advice. We were talking about like her visual acuity, but she's a virtual client, and we've got blood work and different things. Well, she had a different type of blood parasite that she's confirmed. And when you said processing, she's driving down the road, she texts me and she's like, she took her glasses because she was like, and her left eye went pretty much dark. And she was like, what is happening? Because we had her on some homeopathy and different things of that sort. Come to say, but she still had her ability to tactile and reach and do all these things. And I was like, can you do this? Can you do that? Yeah. Yes. And I said, well, you need to go get it checked, get an MRI.
Yeah.
Get an MRI.
And make sure you get a dilated eye. Make sure it's not a stroke.
Yeah, are you having a stroke? Yeah. And from her other things, she got it, didn't have a problem, and her vision started to come back, and it came back fully. And to her, she'd been on different therapies, and she realized like, oh, my vision's gotten better after that because it was like a reset or something. Is that what happens?
Well, there's two things. I think there's the actual processing, and then there's circulation. Definitely plays a huge bit.
Yeah.
So when I do a lot of referrals to cranial, sacral, and body workers because sometimes the head, neck, shoulder is just tight. And I'm not a massage therapist. So, I need someone to go in there manually and really help those muscles release and relax. And, some of my really good ones, they can actually change my prescription. So if I know where my patient's going, sometimes I might, and my patient's partially functional, I might hold that prescription and get them to go for a few sessions before they come back in, and I'll recheck the prescription.
Wow. So you're saying that if a person out there had like a really tight shoulder and you know that they need body work or cranial work, that you could actually help them start to alleviate maybe the fascia, the binding, just like body work, and then they can get your prescription, then it'd actually help accentuate the correction.
Yes. So one of I have another good story. I had a young boy, and he was horsing around with his brother, and his brother whacked him at the back of the neck with a stick. Yeah. And after this, very fascinating case, he would lift his right arm, and the left eye vision would black out. And this happened every single time.
Okay. Wow.
And so I didn't see him till about, I think, 9 or 10 months after this incident. And so I actually could change it through a set of lenses. So I couldn't totally get rid of that effect. So he'd lift his arm and he'd be like, oh, it's slowed down, but it's still happening. And I said, this particular way of putting prisms, that was what I had in his prescription. I said, most of the time when I have to do this, it's in the neck. So this family ended up going to a very out-of-the-box chiropractor who, number one, imaged the neck. This kid already had a CT, an MRA, and nothing. Totally unremarkable. So had the x-ray of the neck. Chiropractor found it in the neck. Fixed the kid in 14 sessions.
What? And so it actually helped him because the neck caused a visual issue.
Yes. So remember, the brain, the nervous system is not just the brain. That's our tendency to think of it that way. But the nervous system is the brain and the spine. And it just takes one interruption. So yes, some of my patients who have really severe back problems, I had one actually yesterday, very severe back problems, it can start influencing vision. But this family was really grateful because no one had figured out it was in the neck. The kids already had imaging and circulation studies to the head. They didn't think about the neck.
That is so fantastic. So you said about the circulation, about not only blood flow, but you were talking about the cerebral spinal fluid.
Yes.
So does the back injuries prevent the spinal fluid from like going, bathing the brain, or is it like you have to be careful, like a manipulation for a misalignment? Does that prevent spinal fluid from like transferring properly up and down the spine or anything like that?
Well, you think the brain is not really attached to anything, right? It's held together by connective tissue, but the cerebral spinal fluid has to bathe all around.
So that's to go in.
Yes. Yeah. So that's a lot of the cranial sacral therapists, they talk about feeling the rhythm. That's what they're kind of feeling.
Feeling the rhythm?
They're palpating the rhythm. And they can pick up, very small subtleties that are, So.
Did you, when you went and got training, this is what I would love to hear.
Yes, so I took the first cranial sacral course this
When
year.
you did what were some of the, so for the people, because I'm looking at, I want to make sure I get so much of this stuff in here, but whenever you went and got trained and you were learning about the movement of the skull, the movement of the sacrum, what were some of the most profound things you found those affected your vision or vice versa? Well,
really, I think how the body sometimes holds things in.
Really?
That it. So one of my personal incidents was when someone was manipulating me. I had an episode where I actually couldn't breathe. I just stopped breathing, and it was kind of like they called it some trauma coming out of my system, and it felt like an elephant stepped on my chest, and I was kind of profusely breathing very quickly, and I was tearing and I couldn't control it. And after it left, I just had this sense of peace kind of come over my body.
That
and
is
it was
amazing.
just, and yeah, my vision changed during that time when
Really?
it was coming out. So I was like, oh, this is interesting. You are yourself's greatest experiment.
That's right.
And so having that actually happen to me,
Yeah.
I was like, wow, this is different.
Yeah.
And so, but also giving me an appreciation of just the body and the brain, everything being so complex, and how certain things we don't know. Our body keeps score. And
Yeah, that's a great book too.
Mm-hmm.
Do you think that when you felt the elephant on your chest and, like you felt trauma coming out, breathing, I heard it before from an expert's point of view that some, even in like German new medicine and a few other different types of practices, they said that, let's say I have some issues seeing at a distance, right?
Mm-hmm.
And they would say that, is it possible that the processing centers, right? The processing centers, if you emotionally, trauma in something in your life made you feel like, I can't see far into the future, I cannot see far ahead. Could that kind of programming affect how far you see?
Well, yeah. So actually, interesting. I have a story for that too.
Yeah, I want to hear that. These are great.
I had a little girl in my office, and she witnessed her best friend getting hit by a car. They were playing on the street, unfortunately.
Oh, no.
So we actually did what we call a color field, where we map fields. This isn't on the computer. This is done manually, so we can see how much information is she processing. She was processing about 5 degrees. She was always looking as if she was lost, and she seemed very clumsy, very malcoordinated. And this was after this incident. She was physically fine.
Yes.
But just you think about the emotional trauma that.
And she couldn't she was going around with her vision.
Yes. Yeah. So I describe it like, it's like you're looking through a paper tunnel, like a paper tube, and functioning that way. And we had you talked about the clarity, the acuity. We had another little boy. This was during the pandemic. Mm-hmm. He was Jewish, and so a lot of Jewish, they have recessive genes, and so yes, we also did genetic testing because we wanted to make sure it wasn't just some rare low vision process that was going to happen. And he lost vision rapidly within 8 months.
What?
And he was seen during the pandemic. And, we got to the point, we saw low vision specialists, we even got genetics involved. And, his family was very loving, very supportive. I even networked them with, low vision vendors to kind of check out all the cool technology, because he lost a lot of acuity. He went to close to legal blindness from normal acuity in a few months. And I never forget this, because the family said, all this testing is stressing us out as a family more. Yeah. So they decided, whatever it is, it's okay. And they came together as a family, and they told him that we love you. We just, man. And it was very heartwarming. And they called me about a few weeks after they had this family gathering, and they sat him down, and they were just so sweet and supportive. And he woke up one morning, and his vision had come back and went back to normal.
Wow.
And he could see things that he did before. And they still called me and gave me some feedback, which I was really grateful for. But yes, that emotional, when we talk about tunneling.
Yeah.
Right?
Yeah, tunneling.
Yeah.
Yeah.
But tunneling can happen, emotionally, but it can also happen physiologically. So Air Force pilots, for example, if you go up in the air and you're just kind of like, your maverick type style, but you can actually lose your peripheral vision when your oxygen is compromised.
Yes.
Yeah.
That's why, like in a jet pilot,
yes.
That, right?
Yeah, they recognize the signs when they go and their vision starts to go. They have to come, they're not getting enough oxygen in their system.
Wow. So
that whole movie, there's some truth to it. It's
completely.
Just kind of literally graying it from the periphery.
To the periphery. And that's what I think is so amazing when we talk about learning that you can have all these signs and symptoms that could be a possibility.
But still have good acuity. You could still be 20/20.
Yes. Right? And there's so many different things that could affect the processing. Like you said, how it hits the retina and how it actually your brain processes. Yeah. Man, this is really good. I want to I got a couple more questions though, because when we talk about your body and how you're using the prescription to change, I want to talk a little bit guys, about the light that you created. For the eye torch, we call it. We talked about like how to use light or red light, near infrared, to help the eyes and help accentuate some of the energy in the eye.
Yeah. So when I look at how do we change processing, I told you the light enters the eyes, the brain processes light. Mm-hmm. So you can bend it from the outside. You can bend it with lenses. You can bend it with prism. You can bend it with filters, because filters are just, they sort out certain frequencies of light and allow others to pass. Or we can subject the nervous system to light. So this is a torch here. And the torch, this is an external form. I also do another form called optometric syntonics, where we shine certain frequencies and the eyes are open, and that frequency of light is going to the eyes and also changing processes. So red has been in the aesthetic industry for a long period of time. And red is great for healing. It's great for skin rejuvenation. And near infrared is great for neurology. And so combining the two together has been just magical for me, because we are now able to influence the nervous system in a safe way, and that patients can take it home and start healing themselves in a much quicker rate.
So when you take the red light, this is great, because I want to tell you my personal story. Some people are always afraid, because you calibrated this and created this so that it's safe to put, like if you do over the eyes, because people are like, oh, don't put in your eyes, but you say no.
Don't look at it, right?
But like you can go around and it's not going to bother.
Yeah, you can put it close. So red is interesting. Red can penetrate a little bit more than a centimeter into skin.
Okay.
So it can get rid of some lighter surface inflammation. Mm-hmm. So there have been studies where red can get rid of some inflammation in the eye. So it's good for dry eye.
Yep.
And so that is where some of that red and the near infrared, again, we kind of work on the neurology, because what's in the eye? Retina. What's retina? Brain. So we can actually start influencing brain process. But we can also influence, if you look at the skull here, it's very narrow, and it's actually the skull, the area around the eyes is thin. So we can also affect the eye muscles. So I've been using it to influence and help the nerve palsies, like when patients lose control of their eyes because of a nervous system problem. We can change the course of rehabilitation through that at a much quicker rate.
Wow. So you can use the light, because the light helps with energy production. It helps with tissue healing, right?
Mm-hmm. It helps bring lots of circulation. So even if it's just to bring circulation to the eyes, most of my patients actually, after we put the red around the eyes, we can look our eyes back and forth and make the eyes jump. And most of my patients will tell me, it seems to jump a little faster. And I said, yeah, because we just brought a lot of circulation. But even some of my patients who have been on the computer for long periods of time, and you feel the pulling, you feel the strain around the eyes, we can put the red there and just feel it relax.
That's it. To me, with this, two personal stories real quick. I went and got my examination with Dr. Ho. And I had a 20/80 issue, because I've had central serous retinopathy, which basically like some leakage around the retina from old infections and inflammation. Long story short, I've heard like you could put light around the eye, but she created this, and I was so astounded, because I'm like, you could put that heal the eye, because eye is neurological tissue. We did it, and she showed me that we went from like 20/80 to 20/30 within like a couple minutes. Like she did this, and she said, put it here. And my visual acuity and the way my eyes could move was so much better. Like I actually had less ease, and I slept really well the next 3 nights.
Yes.
And I've been doing, like, I'll do this. And now another thing, I went to London, and I have some patients that come here, and I was out in London for a conference, but one of my patient's son over there, he's a patient of mine, and he does a lot of like sports and a lot of football, soccer.
Yeah,
and when you would check his eyes, I'm not acting, but as an optometrist at all, I would just say, follow my finger and see what's going on with your eyes. And he would have like a little nystagmus where the eyes would jump. They would stall and shoot. And they would, and literally when he was looking to the left, looking to the right, no problem. So I was like, well, I know some Chinese medicine stuff for the eyes. I did some of that. So I took this, and I was like, well, I'm just going to do some muscle testing. He's like, oh, it's right here. And I said, I did that. And I mean, within 30 seconds to a minute, I started doing that. His eyes were just as smooth as he could be. And he goes, huh. He's like 11. He goes, my eyes feel less tired right now. And I told him, I said, if you do that, it may change your body. So I don't know. Yeah. So he texted back to his friend. He goes, my muscles are really sore in my legs.
Yeah.
After that.
So just like when I changed my eyewear, I was really sore for 3 days. And I was just doing some of these stretches the trainer taught me, probably less than 10 minutes of it. But my body felt like it went through a workout for the next 3-4 days. It was sore. It was sore in very particular small strips of muscle.
Yes.
And then once it left, it was great.
I think when you say when you say that it helped and it went away, it was great. That I want people out there to realize, though, when we do a prescription, when you do a prescription, that these are changes that are affecting your nervous system. To me, it's like very profound. Like this is not just small therapy that you're actually literally making changes to your brain when you're doing this, and these things will last. That's what I love about it, though.
Yeah. And sometimes they need reinforcement. They need reinforcement through the motor because it's been in them for very long. Yeah. So I love working with other professions like you, like my motor people, to help get that patient to have the whole package come in, not just vision, but their body, and so that they can enjoy life. Oh,
I love it. I mean, because this has been a good session. I would say that I always bring my little man doll, female doll with me. And one of the things that Dr. Ho and I were talking about before is with optometry and eyes, the eyes in like the TCM or classical Chinese medicine world always relates to liver function, liver health, and gallbladder health. And one of the things that I see many times when patients come in and they say, well, my eyes get dim, my aspect would be I always check like the bile ducts, the bile tubes in the liver, if there's any infections up in that area, because it's a cleaning system. And I think it's so great, though, when they talk about how if the liver or the gallbladder gets congested, gets toxic, honestly, it's dirty blood. And that blood will shoot up into the heart. There's little veins that go right up into the heart. And you were saying that when the heart is pumping and it's pushing all that blood to the brain, remember, if your liver is tired or congested, it can put a little bit of dirty blood up into the eyes. And I think that's really great about how these things can coincide with each other, like body work and TCM or Ayurvedic, and then alternative medicine. With your aspect of optometry and how it all can be correlated. So the whole goal for this podcast, though, too, is not only to show your awesome stuff and also show you the actual avenue, but to show people that you can actually change your physiology. Pretty much, you can change your biochemistry too, if you just by doing some changes to your eyes, and showing people that if your eyes are going double vision, if you're having dimness, if you're having quote age related, you need to go get it checked out by a doc. Like Dr. Ho, really, you need to check it out because it could be circulation, right? Yeah. That's not getting up to your head from your neck being torqued.
Yeah, definitely. I've sent people out for imaging. We've sent people out for cardiac workup because sometimes, sometimes there are some very serious medical problems that are just on the brink of happening.
Wow. I love it. Eyes are windows to the soul. I am all about this. I think that it's so intriguing, and we'll have you back on more and more. If we found like you and I talk and there's like a great subject about this, because people out there's a few things people are really, they don't want their eyes to go, their ears, their hearing, or their teeth. And a lot of it, people are very, very adamant. So I want this to be very educational. And Dr. O, thank you so much. How do people find you? I want to know all of the ways we can get a hold of you.
So you can visit our website. That's probably the easiest way. It has all our contact information. It's www.hovisiongroup.com. You can email us, which is info@hovisiongroup.com. Or you can, find us through Dr. Motley, because Dr. Motley can always send us information.
We can definitely do it. I'll put, guys, on the caption, we'll put the information there. And we will put how you can contact with her. And guys, if you have more questions about vision, and you want Dr. Ho to come back on, to answer a particular question, send that to us, and we'll have her back on to do more of that. We are here to make sure that we give you the basic tools to actually help your life. I've got to get my prescription filled. I was telling her today, got to get the right frames. But I really appreciate you joining me today. This has been fun. It's been really super flowing, and we want you guys to have the best time when you listen to this podcast. If you guys like it, please give us a like, give us a subscribe. And if you know anybody else that has vision problems and you know that there could be extra things with that vision problem, send them to Dr. Ho, see her information, but send them this podcast and see what happens, all right? From all of us here at the Ancient Health Podcast, thank you, Dr. Ho, for joining us. Guys, we appreciate you. Have a great day.